If you have groin pain, it can be extremely worrisome. And the first things that many people worry about is either a hernia or some sort of problem with their reproductive organs. And there are different concerns for women and for men, but the good news is that most causes of groin pain are musculoskeletal causes that aren't serious. I'm Dr. Dave Candy, and in this video, I'm going to describe different causes of groin pain for women and for men, as well as the common musculoskeletal causes that either women or men can have, and some treatments that you can use to relieve the most common causes of groin pain. So first of all, what exactly do people mean by groin pain? And that's a really good question because people describe groin pain in different ways. Some people refer to it as lower abdominal pain or pelvic pain. Sometimes it's pain in your genital area, or other times it can be just inner thigh pain. And so narrowing down what exactly you mean by groin pain is a good first step into figuring out what causes it. So let's just first get the concerning things out of the way, the things that people worry about. So in women, causes of lower abdominal pain that comes from more of the reproductive organs can be endometriosis, ovarian cysts, uterine fibroids, or pelvic inflammatory disease. Now, most commonly, those will cause lower abdominal and groin pain. The pain may be fairly constant, or it may vary with your monthly cycle. But if you're having lower abdominal pain that goes into your groin, particularly if it varies with your cycle, then it's a good idea to check out with your gynecologist and figure out what's going on. Now, another cause of groin pain in women is pelvic floor dysfunction. And that happens either when your pelvic floor muscles aren't strong enough and not working enough, or when they're too tight and too stiff and overworked. And your pelvic floor muscles are just like any other muscle in your body. They can be painful because they're too spastic or too tight, or they can be painful because they're not working well enough. Now, when they're not working well enough, the most common symptom that people get is that they leak urine. For example, when they're jumping or laughing or running, or if they sneeze. Those are common signs that your pelvic floor muscles may not be working as well as they should. And if you look at the TikTok or Instagram or YouTube feed of any pelvic floor physical therapist, the most common theme that you'll find is that leaking as you get older is not normal for women, even if you've had children. Most people will advocate doing Kegels if you look at the mass media, but that's not perfect for everyone. And especially if you have the opposite problem. Now, if you have too spastic of pelvic floor muscles where they can't relax, you may find that you have trouble urinating, or you may have pain when you have sexual intercourse. So if you have too spastic of pelvic floor muscles, the last thing that you want to be doing is Kegels, further tightening those stiff muscles. Conversely, doing relaxing exercises like diaphragmatic breathing, and also making sure that you have enough flexibility in your hip flexors and adductors, those can be helpful things if you do have spastic pelvic floor muscles. Now, another really common cause of groin pain in women, if they're pregnant or postpartum, is groin pain right in the midline, sort of in the pubic area. And that's caused by pubic symphysitis or a pubic symphysis dysfunction. And the pubic symphysis is a little disc of cartilage that sits between the two hip bones, or the two pelvic bones where they join together in the front. And when you're pregnant, it makes the collagen fibers in your body a little bit more flexible. And so that pubic symphysis, it can shear a little bit, and one side of your pelvis can either slip up or slip down or twist a little bit, and it can cause a strain on that fibrocartilage, that pubic symphysis, right in the midline of your pelvis. So wearing an SI belt or a maternity belt and strengthening your lower abdominal muscles, your pelvic floor muscles, as well as being able to relax your adductors and your hip flexor muscles can be one thing that can help give you a little bit better stability and less shearing on that pubic symphysis. Now, pubic symphysis pain can happen in men, but it is a little less common and usually happens from repetitive activity. Now, in men, the main concerns are a hernia. An inguinal hernia is when your abdominal organs, usually your intestines, will start to protrude down through the inguinal ligament or the inguinal canal, which sits right in this area in your groin. And it'll come down into the scrotum, which is where the old turn your head and cough test comes from, that the doctor's feeling for if anything has slipped down in that area. Now, I actually have a personal story where I got concerned of that type of problem. Back when I was in college, I was doing really heavy lunges and just felt an immediate pain. And I swore I had a hernia, but actually it was a pubic symphysis dysfunction. That when you do a lunge, one leg is forward and one leg is backwards. And so one side of your pelvis is going one way and the other side is going the opposite direction. And that's one thing that can actually cause a pubic symphysis dysfunction. And so even though they're more common in women, like I said, they can happen in men as well. So the other concern that men have is a testicular problem, either epididymitis or a testicular torsion where things get twisted or rotated. And so if you are having that problem, it is good to see your doctor or a urologist to get those problems ruled out. But like I said before, the most common causes of groin pain in both men and women are musculoskeletal problems, either from the hip joints or the muscles that go around the hips. So before we get into the more common musculoskeletal causes, how do you tell whether it is more of a musculoskeletal cause or more of a reproductive cause? And location can cue you in quite a bit. For example, if you're having lower abdominal pain that's non-varying or varies with your menstrual cycle, that's more likely a reproductive cause. Or if you're having other associated symptoms like generally feeling unwell, or you have a fever, or you've had some weight loss, or you're having trouble with your bowel or bladder functions, that may cue you into something of more of a reproductive cause or even some kind of cancer. Now, on the contrary, musculoskeletal causes like hip problems or muscle problems usually are more related to activity such as exercising or movement of the hips. So what are some of the more common musculoskeletal causes that can give you groin pain? Well, the first and most common cause is just hip arthritis. And that can happen as you age where you lose space in the ball and socket joint. And that type of pain is typically more common when you're bearing weight on your hip joints, particularly for long periods of time. If you've lost some range of motion in your hips and you're having trouble bending down and you get groin pain, that can be a sign of hip arthritis. Now, there's another sort of internal hip pathology called a labral tear or a labral pathology, where the fibrocartilage disc that deepens the hip socket, that can get irritated or pinched or impinged or torn. Now, I have another video about a condition called femoroacetabular impingement, which is where when the ball and socket isn't moving properly in the hip, it can pinch or tear the labrum, particularly when you're going into positions where you have your hip flexed like this, adducted and internally rotated. Or it can happen when you go down into a squatting position. So I'll refer you to that other video for more of how to treat labral problems from a hip impingement. Now, next, let's move on to some of the muscular causes of groin pain. One common cause of groin pain is something called athletic pubalgia or a sports hernia. And that's not to be confused with an inguinal hernia. It's actually a muscle problem, but that's not a really good name for it because it's not very specific. It can be any of the attachments of the muscles that go up into your groin, the adductor muscles on the inner thigh, your rectus femoris, which is one of your quad muscles, or your lower abdominal muscles. But any sort of tendinous attachment that is inflamed on the pubic area is what's called athletic pubalgia, or some people refer to it colloquially as a sports hernia. Now, next, what about a groin strain? Well, groin strains aren't as common as people tend to think they are. Usually it comes from a slip or fall, like if you fall on ice and kind of go into a splits. Or for hockey players, groin strains are more common in hockey players or goalies, where they're in a position and they slide out and overstretch their groin, where they go too far into hip abduction, and that stretches or tears the adductor muscles, which run down your inner thigh. And if you've gone too far out into that position and stretched or torn the groin muscles or the hip adductor muscles, well, the last thing that you want to do is to further stretch them. But that's something that people commonly do when they have a sore muscle, is that they think that they should stretch it. And you should stretch it if it's a stiff, tight muscle. But if it's an overstretched or strained muscle, you don't want to stretch it. So what about stiff, tight muscles in your groin? Well, it is actually very common to get trigger points or knots in your groin muscles, particularly if you have weak outer hip muscles. If you have weak outer hip muscles, then you're going to fall down like that as you're walking when you have weight on one leg, and that's going to relatively make these inner groin muscles a little bit stiffer. Additionally, because we sit at desks most of the day with our knees relatively together, we don't get out into that really widely abducted position. Our groin muscles can get tight just from that static, stationary position of sitting with our legs close together. So in that case, doing groin exercises or groin stretches is actually a pretty good idea. Now, one good way that you can do that is just doing the position that I mentioned earlier, doing a sideways lunge. And that stretches out the inner thigh muscles or the hip adductor muscles that run up and attach into your groin. Another way to do that is to sit down on the floor and do a butterfly stretch, where you push your legs out to the side like that and just hold it for a comfortable stretch. And so that's the butterfly stretch. So those are both good when you have stiff muscles in your groin. For example, when your groin muscles have gotten too tight or developed knots or trigger points. Now, what about strengthening exercises for groin pain? Well, if you've strained your groin, you don't want to immediately contract that sore, strained muscle. And likewise, if you have stiff muscles, you don't want to further stiffen those muscles up. So those machines that you see at the gym where you push the pads together, the hip adduction machine, where you sit in the chair and you kind of push the pads in that way, those actually really aren't too good for groin problems because they just stiffen up tight muscles and they irritate already overstretched or irritated muscles. Now, conversely, hip abduction exercises where you're going out to the side are better. So the machines at the gym where the pads are on the outside of your knee and you push outwards are actually pretty decent exercises, but there are better ways to strengthen your hip muscles that are a little bit more functional. Now, because when you walk, you have to stand on one leg, just practicing balancing on one leg without letting your pelvis drop down is one really good functional way to help strengthen your hip abductor muscles. To make that a little bit harder, you can do single leg squats and try to maintain your balance, or doing lunges is another good way to strengthen your muscles. Just don't get down too deep or go too heavy, or you may experience groin pain like I did. So those are some strengthening exercises that you can use if you have groin pain. Now, because groin pain can come from internal problems, it is a good idea to have groin pain checked out by a professional rather than just trying to treat it yourself. And if you happen to be in the St. Louis area, we'd be happy to help you out at More for Life and help you figure out if your groin pain is coming from more of a musculoskeletal cause and give you the right treatments for it if it is. And if you're watching this from somewhere else, but you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos.